Hi, my name's Ed Shanshala. I'm the CEO of Ammonoosuc Community Health Services. At ACHS, we provide primary preventive health care. We do so that each of us can stay healthy. Why each of us stay healthy is a very personal and unique story. The following is a personal and unique story of one of our friends, families, or neighbors and why they stay healthy.
I think minding your body is incredibly important. I live in a family where my sister-in-law died from breast cancer at 25. We knew all about breast exams. We knew about monitoring. We knew about taking care of your body and listening to signs. But I never really thought it would apply to me. I was diagnosed with synovial sarcoma, which is a rare soft tissue cancer, in the spring of 2015. And it was a very unexpected diagnosis. I went in with what they thought was a torn rotator cuff and came out with a very aggressive cancer. What's been interesting about my treatment is I've all along basically had a tri-state healthcare team. So I have had treatment at Memorial Sloan Kettering in New York. I've had treatment at Dartmouth-Hitchcock South in Lebanon, and I had care at Dartmouth-Hitchcock North in Vermont. One of the most impressive aspects of my care was the complete lack of ego, which is uncommon in the healthcare industry. I felt very strongly that all of the physicians that I worked with had my best interest at heart, and my survival was their top priority, not publishing a document, not getting research numbers. It was really about my best chance at making it through a pretty significant situation. So I was incredibly impressed at the care that I've received from, everyone starting at ACHS, through Littleton Healthcare, through Dartmouth, through Sloan Kettering, and the willingness of people to communicate. I found it incredibly impressive and is probably why I'm still here 8 years later. When you enter the world of cancer, you have really no idea, no concept of what that means when you hopefully come out on the other side of it. And what I have learned throughout that process is monitoring is essential. One of the dangerous things about the particular cancer that I had, and many cancers, is that there's a high chance for recurrence. And it's not necessarily where the cancer originally developed, which in my case was in my left axilla, which is a very fancy word for armpit, but instead it metastasizes to other parts of your body. I am now exceptionally susceptible to upper respiratory infections, which are a consequence potentially of the cancer that I had, and the fact that I now have lymphedema as a permanent side effect. And I had radiation to my lungs. So they watch my lungs very closely. So my care team at ACHS makes very sure that when I inevitably develop an upper respiratory infection, which happens at least once every year, that I'm tracked and that I am seen without having to necessarily wait 2 weeks for a visit. And they take that very seriously. I was incredibly fortunate. Most people with my kind of cancer don't find it until it has metastasized and it's too late. I was able to listen to my body. I was able to access healthcare. I was able to work with clinicians who took me seriously. What we know now is you have to listen and you have to be your own best advocate. When something isn't working properly, when something doesn't feel right, it behooves you to get it checked.